Now, I am inviting Dr. Srikant Talari to begin the session, and today, Doctor will be discussing about miasm uh, in homeopathy practice. As you all know, this is a very important subject. Due
Hmm.
to some network failure, I couldn't continue the session. Because of that, the Zoom has gone. So we can begin the session once again. We proudly welcome our guest of the day, Dr. Srikant Talari. Welcome, sir.
Thank you, sir. Thank you for having me. And
Yes, we can see the slide and everything fine.
so, as I always do, I will like to share cases, uh, experience from my practice that I've learned of how I use miasms. And this is a new thing I learned recently in my practice. So, when we think of miasm as a concept, so Hahnemann said the cause of any chronic disease is miasm. No? What happened? So the cause of any chronic disease is miasm. So generally, when I had started practice, I used to um, think that uh, we studied these three miasms, no, like Sora, psychosis, and syphilis. So I used to think that patient will either be Sora or psychosis or syphilitic, or like Hahnemann has said later on, that miasms have got overlapped over each other, and there is a combination of miasms that you see. So then we used to say that all remedies have all miasms. Miasm is not such a important thing. You have to just prescribe based on the symptom similarity that you see in front of you. So prescribe just based on keynote symptoms. Prescribe just based on mind symptoms. Prescribe based on physical generals. This is how I used to practice that. Essentially, if I address or if I find out keynote symptoms or mental symptoms or physical generals, miasms will, you know, be automatically addressed. Sometimes what you may need to do is you may need to give a intercurrent remedy like some medorinum or sorinum or um, civilinum or sulfur or remedies like that as intercurrent, and that will be good enough. That's how my understanding of miasm was. And I think many of us have similar understanding that if you treat based on symptom similarity, that's enough. In between, you treat intercurrent remedies, because nowadays you don't get very clear SORA, very clear psychosis or syphilis. So if you find clear picture of SORA like functional disease, hopeful, itchy, scratchy, scabies, etc., you can give sorinum. So occasionally we do give such remedies, but majority times we are giving remedies just based on keynotes or these three set of symptoms. Now, once what happened that I was treating a case of sigmoid colon cancer. Okay, now this was a female who was around 50 years old, and her son was a homeopath, or rather, he's a homeopath. Son is a homeopath. So he referred, he said, sir, can you please help my mother in whatever means? So this is a very advanced case of cancer. So I said, what happened? So he said that she has this sigmoid colon cancer. 3 years back, she was first diagnosed. So at that time, we operated it, we did chemotherapy, she did fine, and then after 1 year it relapsed. Then again we operated, again we gave some chemotherapy. Mm, and again it relapsed after another one year. So she has sort of underwent 3 surgeries, chemotherapies. Now they say there is nothing else that we can do. And also her intestine, they have been cutting every time, every surgery. So it has become very short. Now she has a stoma bag. She's can only pass stool through that stoma bag, and that stoma bag is showing not much of stool nowadays. So, on top of that, she's having severe pain in abdomen, and she's constantly vomiting. Vomiting is greenish yellow color. Hmm. And there is burning pain in abdomen, hmm, which is better by vomiting, or which is better by warm drinks, or by warm fermentation. Uh, she's continuously vomiting. She's continuously vomiting, and she has gone very weak, lean, thin, emaciated. Okay. Along with that, she's feeling very irritable. So ask him, what is the history? Why did she develop all this? So he says that what happened is, actually the patient says that I have always had chronic acidity problem. So what is the problem? So she says that uh, mm, if I ate anything spicy, then I used to have acidity. And what do you mean by acidity? And then I used to have vomiting, diarrhea, all these symptoms I used to have. I used to have a lot of vomiting and diarrhea. So what I used to do, I used to manage with antacids. Said, why antacids? So she said that I was, I loved eating spicy food. I love chilies, spicy food. All this I love. So I could not, sort of resist myself. So what I used to do, I used to eat all this, and so that I don't have acidity or all these vomiting diarrhea, I used to take antacid. And like that, I continued for around 15 to 20 years. For 15 to 20 years, I was constantly taking antacid, and I was eating all these spicy food. Otherwise, I could not eat spicy food. So like that, I continued. In between, I used to have little bit nausea, vomiting, little bit diarrhea here and there, but I continued like that. And then suddenly they said, now you have lots of diarrhea, so and you are losing weight. We don't understand why. So let's examine, let's investigate. And then they found out I have sigmoid colon cancer. That is my history. Okay. Now I ask her, are there any mental, emotional stress that you have? Hmm? So she says, no, I'm a farmer. What is there? There is no tension. Every life has been good. My life is what? Go early morning, go to the farm, work, come back home, eat food, sleep. So, so Not so much of any mental emotional stress or irritability, anger. Sometimes if acidity is there, I will become irritable, I will become angry, I will become snappish. Hmm? I will be a little bit impatient, like that. Hmm? So that is the sort of um case in short. Just 1 minute. I want to open that case. Okay, where is screen share? So these are her symptoms: colic in abdomen, back pain. She's also having back pain, lot of weakness, better by vomiting, warm drink, warm fermentation. I also feel very numb, like anesthesia, no desire to walk. I have severe back pain. There is pain inside body, no life in me. I've gone very weak. She was very, very thin actually. Hmm? Appetite is good, but I am not able to eat because if I eat immediately, there will be burning pain, vomiting, all that. So I'm scared of eating. Hmm? She's thirstless. She desires masala and spices, etc. Hmm? And there is aversion to potatoes and brinjal and curd. Hmm? So that is the case in short. One more thing is the pain is aggravated at night, especially. Hmm? So, can anyone suggest what remedy comes to your mind? Hello? Hello?
Yes, sir. Nobody is responding, sir. Please write in message.
So, can anyone please respond? Any remedy that comes to your mind? Okay, we have a response. Thank you. Very nice, Dr. Sheila. Remedy that one of the remedy that comes to our mind is arsenic album, right? So, actually, I gave her arsenic album. Why I gave her arsenic album? Because patient has cancer, there is burning pain better by warmth, there is weakness, profound weakness, constant vomiting, constant loss of fluids, uh, diarrhea, profound weakness, prostration, all these symptoms. I felt arsenic seems good. And also, mm, if you observe, there is a rubric in the repertory: burning pain better by vomiting. One of the remedies was arsenic. So I felt all symptoms are fitting, and desire for spices. And then I saw some physical journals like desire for spices. So if we look at that rubric, just let me share screen. Let's see repertory. So if we look at this rubric, desire for spices, food, spice, desire. Huh? You see, there also arsenic was there because she has this strong desire for spices. No, if I don't eat spices, then I can't live. I will continue to eat, even if I have acidity. And because she continued to eat, she continued to have symptoms, and she suppressed those symptoms with antacid. So that chronic disease slowly increased and became cancerous. So I thought arsenic is good. I gave arsenic album. She comes after 1 week. She says, I have no relief at all. I said, Are arsenic, though, very clear. No. especially with that modality, burning pain better by warmth. I said, get take 1 m, no relief. And she was growing weak, very weak day by day and vomiting continuously. So then I said, no, now I have to retake. Now, what to retake? Where do I look for symptoms? I have taken physical generals. I have taken local symptoms. I have taken cancer symptoms. There are not much mental symptoms. So where to look for symptoms? So at that time, um, I started to think what could be the probable reason for her cancer. So first reason I thought was lifestyle cause only. No, that she is eating this compulsive desire to eat spicy foods in spite of getting aggravated. So desire for spices is the most sort of strong, intense desire. And Ken says desires and aversions are to be given the highest importance. So I have taken spices desire. So I asked her and the son what else she desires, aversions, anything like that. So we discussed a few things, and then suddenly they said, there is one thing, doctor, that is important, that right from her childhood, huh, she is not able to take buttermilk in any form. If she takes buttermilk, she will have aggravation. She is almost like allergic to buttermilk. Why we don't know. This is much before even the acidity. So then what I did, I re-repertorized the case. I said first thing that the remedy should have is buttermilk aversion more than spice. Because what I realized in that moment is that this buttermilk is a inherent symptom. Aversion, not aversion, aggravation from buttermilk is an inherent symptom. It is there before any disease began. See, spices desire is there, but it is still in her control. If she had stopped eating, then maybe she would not have developed cancer, but she chose to continue to eat. But this aggravation for buttermilk, it has come with no cause. It is there right since birth. So it's like a genetic symptom. And in that moment, I don't know how, but I had this realization that Hahnemann says we have to treat miasm. Miasm, he says, are inherent symptoms that are transmitted through generations. If I have one particular disease, that particular disease, if it is has a miasmatic cause, then that miasmatic disease is transmitted to my next generation. That is why inherent symptom, genetic symptoms that run in family are miasmatic symptoms. So I thought I have to treat the miasmatic symptom like Hahnemann has said. So I gave the greatest importance to buttermilk aversion. I said whatever remedy I choose, it has to first have aggravation from buttermilk, not aversion. Aggravation from buttermilk, and then it should have desire spices, and then it should have burning pain in abdomen, which is better by warmth, and then it should have vomiting, burning, etc. So then I repertorized the whole symptoms in this chronology. I will show you the repertory sheet now. When I repertorize in this chronology, this is the repertory sheet I get. See, buttermilk aversion, epigastric burning, spices desire. Actually, if you see this rubric, spices desire, bryonia is there over here. Okay. If you see here, bryonia is there. So first symptom is aversion, buttermilk, then desire, spices. Then I take all local symptoms. And I see first remedy that comes up is bryonia. So I gave her bryonia. She did very well on bryonia. Her burning pain stopped. Her vomiting stopped. She could eat little bit. When she started, she was not able to retain even food for 15-20 minutes. After bryonia, she could retain for 1 hour, 2 hours. She also passed a little bit of stool after many months. There was stool in the stoma bag. Otherwise, whatever she ate, she would vomit. She would vomit. But suddenly, the Body started to respond. Her vomiting completely stopped, actually, that greenish yellow vomit, all that improved. Hmm. She did well on this remedy for, I think, a month or two, but it was too advanced a case. And after a month or two, she expired. So, this is the case uh, which taught me the importance of miasmatic symptom. And it also sort of cleared a few more things for me. Like what? Things like you don't need to always prescribe by or say that miasmatic remedy has to be fit into a tagline. Like for example, we will say that patient has cancer, so cancer is a syphilitic pathology, so remedy has to be from syphilitic miasm. This is a trap. This is a trap. Because firstly, Hahnemann is very clear, we do not prescribe on pathology. We prescribe on miasm. And miasm in Hahnemann's chronic disease, if you read it, he has only enumerated symptoms. That's it. He has not even given picture. These pictures that Sora will be like this, psychosis will be growth, and syphilis will be destructive. All these came by later authors. Hahnemann himself has not said that Sora will be like this only, Sora will be functional only, Sora will be skin only. In Sora also he has written certain destructive symptoms. In psychosis also he has written. In syphilis also he has written. So the point is, rather than getting stuck to a particular picture of a particular miasm, what we should do is, what I've learned is that we should pick up the genetic inherent symptoms that are there in the patient much before any disease began, and that symptoms are the predisposing symptoms. Now those symptoms predispose the patient to a particular disease, and that predisposition, if it is complemented by external factors, like in this case the external factor is constantly eating spicy food, if you complement that inherent factor with the external supplement, then patient will start having disease and patient will start developing disease. But the core is that we have to focus on the inherent genetic symptoms. So let me share one more example. Till now, am I making sense? Are you all with me? Can you relate to what I am trying to say? Yeah, can you please respond in the chat box? Any questions? Sir, I think Dr. Jolly PS wants to ask something. She has raised hand. If we can unmute her.
Yes, yes, Doctor Sir. Your selection of bryonia is very, very excellent. But pathology is also important. That is after we diagnose the case, then the homeopathy can go anywhere. We can select according to mind, and that your point, that genetic symptom selection is a very an excellent decision. So almost
Thank you,
all
ma'am.
cancerous developments in the later generations are only through genetic. And you took that rubric aversion, not intolerance of buttermilk, not aversion, intolerance, a genetic. So a very good and very excellent prescription. Thanks.
Okay, ma'am. Thank you. So let us see one more case. So this is a case of a middle-aged male patient. He is around 30 years old, 28 or 30 years old, and he comes with multiple complaints. He says, I have recurrent cough. Hmm. Then he has indigestion and acidity. Another complaint he has is he has um, crackling in joints. Hmm. So these are his three basic complaints. Hmm. So I ask him, let's talk about your most bothersome. He says, my most bothersome complaint at present is cough. I said, talk about your cough. So he says, my cough is like this, that I have to keep coughing at night and I'm not able to sleep. And this cough especially happens if I eat anything oily. I said, What kind of oily?" So he said, not specifically any particular food, but suppose if I eat Chinese for 2, 3 days, or if I eat some oily, greasy food for 2, 3 days, then I feel there is a sort of cumulative effect. One day I will eat, it will not happen. But 2 day I eat, 3 day I eat, then I will start knowing, now it's getting to me, and now I will have cough, or I'm going to get ill. Then I'll get ill, then I will develop fever, then I will want what desire warm drinks, then I will feel very dull. Then I will feel I'm not able to concentrate. I'm not able to concentrate. At, what happened? Concentrate at work. I'm not able to concentrate at work. I and all these symptoms will develop. Any other reason why you have cough? So he says, no, it is a cumulative effect. That is all I can say. Okay. So tell me about your indigestion, your acidity. So again, if I eat anything sort of sour, anything oily, hmm, or anything spicy, then I will start having gases in abdomen. And there'll be so much gases in abdomen. I will have distension, I will have pain, I will start feeling dull. I will have very less confidence on myself when I go to work. Will I be able to work? I don't want to work. I want to just rest. I want to go home and sleep. So I'll feel very dull and very low in confidence that, Arey, now in this state, if boss comes, if he asks 2 questions, and I will not be, my mind has become dull. No, I'll not be able to concentrate. I'll not be able to answer his queries. Then he will become angry, he will shout at me. So I'm like, yeah, when is the day getting over? I want to go home. I want to pass stools. My stools also, sometimes they are good. Majority times I pass stools normally, but occasionally I'm not able to pass stools, etc. Mm, okay, what else? I said, how, since when you are having this digestion problem, acidity problem? So he says it started around 2 to 3 years. Acha, I said, what happened around 2, 3 years? No, that is when all this cough problem also started. I said, cough problem also started since there. Yes, since then only I started feeling recurrent. So what happened 2, 3 years back? Why did you develop this complaint? No, that I don't know. At that time, I was feeling little bit feverish. One day, I went to the doctor. They examined, and I think after a few days, they said that I have jaundice. And since that jaundice, this digestion complaint started, and at that time they investigated a lot. They said, "Why you have jaundice? Why you develop jaundice? We are not able to understand. Very strange. No, without cause you have developed jaundice. Your other liver functions are normal, your bowel movement is normal, your digestion is normal, your appetite is normal. You don't show signs of any disease anywhere else in your body, that because of some other, maybe, maybe genetic disease, or maybe some other part of your body getting affected, you are developing jaundice. We are not able to find why you developed jaundice, but they treated me. It lasted for a long time, and it slowly went away. So I asked him, "What do you feel? What could be the reason? Why did you develop this jaundice?" So he says that I also don't know. Maybe because I'm living in hostel, I'm eating all this outside food. That could be reason. But actually, this is not the first time I have developed jaundice. Even in my childhood, I had jaundice. At my birth, my mother used to tell me I had neonatal jaundice. Okay. And that is where it all then started. Then I asked him, what is the complaint about crackling in joints? So he says, I have this crackling in joints. This runs in our family. I said, what runs in your family? He said, my mother has rheumatoid arthritis. My sister, who is already my patient, who sent me to you, she has rheumatoid arthritis. You are treating her for that. So that runs in our family. So I am also starting to have all those symptoms. My joints have now started to crackle. Even if I do like this, then I could hear tuck 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 noise was coming. So I am feeling in few days I'm going to also develop rheumatoid arthritis. Hmm? And then he said that I have um, craving for groundnuts, a strong craving for groundnuts. And then I asked him about his mental symptoms. Hmm. In the mental symptoms, and patient was another important physical general was patient was thirstless. So I asked him, talk about your mental symptoms. So he says that, doctor, since childhood, my confidence is low. I said, why? No, I used to study in a school, and in that school, initially, I used to be a little bit mischievous. But one day, what happened? My teacher really scolded my friends. And since then, I got very scared. Since then, I stopped being mischievous. I said, what? The teacher scolded you or your friends? He said, friends, not me. I said, friends, he scolded. So why you stop talking? No, you know what? I have two sisters, no? So my elder two sisters, they were topper in our school. So everybody used to look at me and they say, अरे ये उनका वो दोनों का भाई है मतलब he's his brother of those two girls. Acha, so then they used to look at me like this. He will also be good boy. But I felt if I do something wrong, then family name will get spoiled. My sister's name will also get spoiled. So I used to feel, Are, I should not do any masti. And then little bit whatever I felt, Are, I, let's do a little bit of mischief. Then I used to feel that. Um, let us do with these friends. But one day, what happened? I saw these friends doing some mischief, and then they got hate, they were abused, all of that. I said, my God, today I got saved. Now, never in my life I will do all this. So, because of that, what happened? Whatever desires, whatever feelings I had, I used to always suppress. I used to keep them inside, and I used to be lost in thoughts with my own suppressed feeling. And I just stopped expressing myself. And that is why, I have so many thoughts going on inside my brain that I am not able to concentrate. I'm always lost in something or the other, and that's why I'm scared. Oh my God, what if boss comes and what if boss comes to know that I'm having all these thoughts and I'm not really concentrated on work. So that's what I'm scared of. Okay. So I said, what is this incidence with your what with your friends? So he said they were teasing some girls, so then they hit, and that's how I got all this. So even today, no doctor, suppose one relative calls me and they say that come now, we have to go there, it's very urgent. So I will immediately go. I will not think, Arey, I was going to rest now, I was having this work, let me go, let me do that work. If we do that work, I will be okay. But I will not think about my work. I will think, if I don't go, then they will pass comment, then they will say, अरे इसका लड़का है और उसका भाई है, हाँ, he is this person's son, this person's what brother, and he is behaving like this. So again, family name, all that will get spoiled. So I don't think my work also I will forget. I will first go, and then once I go, then all this thought starts within. Arey, why did I come? I we had this work. No, I wanted to do this. I want to do that. I wish I was there. I wish I was doing my work. All these thoughts, and I'm not there in the moment. I'm thinking. Why am I here? Why is this? And then all those feelings. I never talk. I never tell anyone because I feel if I tell, then they will say, "अरे बहुत घमंडी हो रहा है, बहुत इसको खुद का करना है, ऐसे हो रहा है." So I will not express. I will keep all my feelings, all my desires within me, suppressed, and all complaints start from there. Hmm? So this is his mental symptoms. So see, this is a case where you have mental symptoms, where you have physical generals, where you have local symptoms. Hmm? Now what to do? Can anyone tell? What will we do? What is our typical approach? Yeah. Any comments by anybody? You can please put in in the chat. Are there any comments? No comments. Okay. Okay. So I will continue. So see, generally, like I discussed, generally the approach that we have is take what is characteristic or take what is keynote. No, first thing. So keynote, what we think? We think keynote is that cough is aggravated by oily food. Okay. Other symptoms are common, that cough better by warm drinks, cough aggravated by cold air or cold drinks. All this is commonly seen in other patient. But cough aggravated oily food, not so common, less common. Huh? And then what makes it even more important is when we go look at the other symptom, which is indigestion. And there also he says, I cannot tolerate oily food, and because of oily food I develop cough. Because of oily food I will develop indigestion. In fact, because of indigestion, I have started having this cough. So there is a connection. What I first start to see is there is a connection between the recurrent cough and digestion. It seems because of digestive complaints he is developing cough, because it's all started after jaundice, no, that he had 2 3 years back. That is why it is aggravation oily food. So oily food is generalizing itself. It is there with the present respiratory complaint and also with the digestive complaint. So I say, according to concept, Boning Hussein's concept of generalization or Kent's concept of generalization, oily food is seen in two different systems, that is respiratory complaint system also, gastrointestinal complaint system also. So oily food is very important. It is characteristic also. If we see in the with regard to respiratory complaint, in GI complaint you can say it seems common, but because it is generalizing itself, oily food is very important. Are you all with me till now? Hmm? Then second thing I understand is that the thing that is connecting both these is jaundice. And this jaundice seems to be present not just 2 years back, seems to be present since birth. He has had neonatal jaundice. He is having gastric complaints even today. He has all his complaints began with gastric complaints 2 3 years back, and that same gastric complaints have now complicated into respiratory complaints. So this sort of jaundice itself, because it is has been untreated, is slowly complicating itself, is slowly progressing and starting to affect other systems of the body. From liver, it went to GI tract. From GI tract, now it has reached the respiratory tract. But the core disease, the fundamental disease, seems to be located in the liver, causing jaundice. And like we learnt in the last case, it is there since birth without any reason. Neonatal jaundice. I am born with jaundice. So then I understood whatever remedy I give, it should be able to address liver. It should be able to address jaundice, because that jaundice is slowly affecting different systems of the body. So then, like oily food is generalizing itself, the another important general pattern is the seat of the disease, the actual seat of the disease is in the liver. Then I look at third symptom. What is the third symptom? That is crackling in joint. That he says this is a genetic symptom only. My sister has, you are treating her. Okay. So then, and I say two two genetic symptoms are what? Jaundice and crackling. And these two genetic symptoms, for these two genetic symptoms, I will like to characterize. What is the characteristic symptom or the general symptom that we get along with jaundice is that everything seems to be aggravated by oily food. So I need a remedy which has liver affinity and which has strong aggravation from oily food. Are you getting this? Secondly, now similarly, I want to characterize crackling in joints. How is the crackling? What is the modality of the crackling? What is the sensation of the crackling in joints? Where is the crackling especially? So, like you saw, this the patient did like this again and again. So first thing I asked him, is it mainly over here? He says, yes, it is mainly in my right wrist. There is crackling that is in the right wrist and it has began from here. So then I see that crackling has especially started from right wrist joint. Okay. Then if we look at the mental symptoms, what we see is that there is a suppression of one's desires to what? To maintain a position or to maintain a certain amount of dignity or certain amount of uh, what happened? Hmm. Dignity in society, that we are, I am his brother, his sister, this son. There is a certain position, we have a certain respect. The actual more important, better word than dignity is we have good respect in society and I want to maintain that respect. in society. And to maintain that respect, if I have to suppress my desires, if I have to suppress my impulses, I will suppress. But that suppression is causing complaints. Okay. So this has to be there in the remedy. So what is interesting is, long story short, the first remedy that comes to our mind when we think of oily food aggravates. What is the first remedy that comes to our mind? Anybody? GI complaints or respiratory complaints aggravated by oily food.
Lycopodium.
One is lycopodium. Okay, another. Hmm?
Pulsatilla.
Pulsatilla. Very nice. The topmost first remedy that usually comes to our mind is pulsatilla. So I said, okay, pulsatilla has oily food aggravates. But does pulsatilla have right wrist affinity? Which is the remedy for right wrist affinity? Anybody? Rheumatism begins in right wrist. Which is this remedy? Right wrist rheumatism. Remedy is Actia. Uh, Actia.
Actia
Spicata.
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 Actia spicata. Now, what is interesting, what is the connection between Actia spicata and pulsatilla? Both belong to the same family, that is Ranunculaceae. And in Ranunculaceae family, uh, the main thing is respect. In Ranunculaceae family, we have Staphysagria. Staphysagria has to do with respect, insult, honor. I want to maintain my honor or my family's honor in society. And to maintain that honor, I will suppress my desires. And that suppression is causing all these complaints. So that is what you see in his behavior. Suppress your desires, suppress your inclination to maintain a good social position, to maintain that respectful status in your society. And suppression is causing all these complaints. Suppressed impulses to maintain respect. That is what is Ranunculaceae family. So all these mental symptoms that you see are from Ranunculaceae family. Pulsatilla says oily food aggravates, huh? And crackling joint says Actia spicata. Now, what to do? Which remedy to give? Should we give Staphysagria, Pulsatilla, or Actia spicata?
Staphysagria. Because
Why?
mind is so important. We are
But
leaving jaundice and oily foods.
but the seat of the disease. Where is the seat of the disease? It is liver, no? Where is the main pathology? It is liver. Is Staphysagria known for liver or is it known for nerves? It is more known for nerve affinity it has. Here we saw that the seat of disease is in the liver. Since birth, patient has jaundice. Okay, so that is when, again, like I said in the previous case, I ask which is the most oldest of symptoms. The first oldest symptom is neonatal jaundice. Is there a symptom which is even older than that? Yes. What is that? Crackling in joints. That my sister did not have jaundice, my mother did not have jaundice, but I have jaundice since birth. But they have what? Crackling in joints. I have what? Crackling in joint. Mother has what? Crackling in joint. So I see that the most inherent deepest symptom that is running in the family is joint complaints. So I allow that joint complaint to take the topmost priority. So I gave him actually Actias picata. Why? Because I have given the sister Actias picata and she is doing very well on Actias picata. In fact, the sister also I had given Pulsatilla first, and for 2 years she was doing well. But after 2 years she was saying, doctor, if I take your medicine I feel better, but if I stop within 10-15 days all my complaints begin. So how, you say with homeopathy everything gets better, I should have been, at least I should not need medicine for 2-3 months and then I come to you. But it is like even 1 month, 10 days I missed medicines, I will have complaints. What are you treating? So then I thought, yeah, this is exactly what Hahnemann said, no? That even after long treatments, patient would not recover completely. And then Hahnemann started thinking, what is the cause? What is the cause? And then came to the concept of miasm. So then I started thinking, this is exactly what is happening. This is exactly what Hahnemann is saying, that at that moment think that what is the miasmatic symptom. So that is when I understood the miasmatic symptom in this case is crackling in joints. So I gave that the highest importance. So I gave Actias picata. I don't know if Actias picata has liver affinity, but I know definitely Actias picata has joint affinity. And I also know that Actias picata, because it belongs to Ranunculataceae family, has this issue of suppression, respect, honor in society. All this is seen in all the remedies of Ranunculataceae family. So I saw Actias picata covers the mental symptoms, Actias picata covers the most deepest genetic miasmatic symptoms. So I gave Actias picata, patient is doing wonderfully well. Most important thing in the follow-up, what patient says is, my cough is better, but interestingly, doctor, my digestion also has improved. It has to improve. If jaundice does not improve, if the seat of disease jaundice does not improve, that means my remedy is not deep enough. Most superficial symptom in this case is cough. Second super deep symptom is jaundice, but the deepest is crackling. So actually all these three symptoms should improve. First few months cough should disappear. Second few months digestion complaint should disappear. Last symptom to disappear will be crackling of joint. That is what is Hering's law, that the oldest and the deepest symptom will resolve last, the most latest symptom will disappear first. This is what is the concept of miasm. And always my main message today is, first, for miasm, focus on the genetic symptom. Don't limit yourself. Don't think that I have to first see whether this is psychosis syphilis, that drug pictures of psychosis syphilis you don't need to follow. You need to follow the symptom. Just catch hold of that one or two symptoms which are the real inherent genetic patterns, and then add on the other aspects into the case, like what is the mental symptom, what is the physical general, what is the desire, what is the aversion, all that you add on, but the core you have to catch with the miasmatic. If you do that, then real homeopathic cures you will see. Otherwise you will see palliations. If you prescribe only on physical generals, if you prescribe only on generalization, if you prescribe only on keynotes, you will palliate, you will not cure. Cure will happen if you touch genetic symptoms. That is why Hahnemann said the cause of any chronic disease is miasm. For cure, miasmatic cure is important. Thank you. I am done.
Yes, Dr. Srikant Talari is it's really a very good session. Both cases you showed were excellent, and why you prescribe in that way, there is a reason behind that. Because of this miasm, you were you were able to find the right miasm at the right time, and because of that, you were able to prescribe that medicine. But nobody ever thought that it is that particular medicine that is this Actia will work for this case in
Yeah.
mental plane also.
So
That is the
just
most
one
important.
thing, sir. I am saying miasmatic symptom, not miasm.
Yes, exactly.
Yes.
That is miasm. Last
Symptom.
week,
If we say
last,
miasm, no, immediately pictures start coming.
yes, yes. Last week we have a presentation. We had a presentation from Dr. Hari Kumar from Kerala. He was also talking like this, and the most important point that we will have to go with the symptoms rather than any other thing, and how it correlates with the patient. Anyway, I am inviting Dr. Karnagar to say a few words to this. Oh, Dr. Jolie has raised. Okay, Dr. Jolie, you can speak for a while.
Yes, sir. That Actia is a very prominent action in liver also. Actia spicata.
Nice.
So
Where is
almost
the reference? Did you find some reference?
Actia is a very good liver remedy. Boric itself, it says it is a very excellent liver remedy also. So you that your selection is excellent because Actia covers liver
Mm.
also.
Yes.
Thanks.
Okay, ma'am. Thank you so much.
So now I am inviting Dr. Karnagar to say a few words as well as vote of thanks to the session. Dr. Karnagar. Oh, what happened here? I think his network. Yes, Dr. And Dr. Madhavi Ambadi, please come forward. You can say vote of thanks to the session. As there was some technical problem, Karnagar has lost his connection. Not responding. This is some problem with the network. Okay, Dr. Sheila, you can speak. The vote of thanks here. Dr. Sheila. Please unmute yourself and you can speak. Sure. Please unmute Dr. Sheila. You are the host. No, there is some problem again. Dr. Jolie, you can say what. Thanks to the session. There was some technical problem with this. Yes, Dr. Jolie. Please unmute. Anyway.
Yes, yes, Dr. Srikant and all that
Yes.
participants of this session. That is actually we are discussing about cancer miasm and the treatment, but this altogether, our respected Dr. Srikant select wonder remedies by genetic. He is always focusing in genetic transmission. So syphilis and psychosis are genetic transmission, and now we understood that the genetic miasms are combined through genetic. So thanks to Dr. Srikant for this wonderful session, and Dr. Danesh and all our respected participants. We are always conveying our all thanks. Thanks, sir. Good night.
Thank you, ma'am. Thank you, everyone.
Thank
Thank you,
you.
Danish sir, for having me. Thank you, IFPH, for having me. Yeah. See you all soon.
Thank you, Dr. Jolie. Thank you, Dr. Srikant Talari, and those who attend the session. And tomorrow we will have another big session coming on. That is a celebration of NIH alumni. So it will be a big day for us because the people from they are sharing their experiences at NIH. Hope all of you will join us tomorrow at the same time. Thank you all. Good night.